Good morning. Dr. Ida Khanum from Pediatric Board Concierge Pediatrics in Bel Air, Houston, Texas. I was just having a little bit of coffee this morning. Excuse me, but I wanted to just come on board and talk a little bit about sports injuries and how they can present and what you want to do as a parent. So, the good thing is that your child is playing a sport. Awesome. There's a whole bunch of sports out there. We'll talk about that later on, why each sport, I think, has a certain thing that your child can learn. But if your child participates in a sport and has an injury, I think the most common are like sprains and strains of the ankle. But if your child does have an injury, and as long as, they had an injury, there is pain, there may be some swelling in the joint, but they're able to put weight on it, the first thing that you want to do is, number one, rest, okay? So do not let them continue playing the sport. Second, you want to put ice on it, so that way you're cooling the area and decreasing the inflammation and the swelling. You want to raise up the limb. So if it's an ankle, you want to put it up, and you can give some ibuprofen to decrease the inflammation and pain. And that is what you want to start with at home. And usually after 24 hours, you should start seeing an improvement. Again, no return to sport until the pain is completely gone. So that's usually with a strain or a sprain. And most of the time, after you've given it enough rest, about a week, 10 days, usually you start to notice that the pain's gone away, the swelling's gone away, the joint is back to its normal mobility. Then you can return your child to sport. Do not do it too soon, because if you go back in and you play a sport too soon, you can re-injure that same joint and then get a more significant injury. If you found this information helpful, go ahead and share with your friends.